Thank you, Tim. So let me give you a little bit of a background on Nanoveu. I started the company in 2012. Unknowingly, it's going to be 10 years next year, and the journey has been predicated on science that's built from the Singapore ecosystem. So A-Star is the largest research institute in Singapore. It's just across the street from where we are. There are about 5,000 scientists, and we basically take a lot of the technology, principally in material science, and commercialize it. So there are several business pillars that we have. Today we'll talk a little bit about the antiviral initiative. Um, Essentially, most of this technology is all based on a lot of materials, a lot of deep technology that has very high barriers to entry. I mean, in today's talk, I'll talk a little bit about how we turn, bare materials into a piece of plastic like this, and through that, we're able to eliminate viruses and bacteria. We have other things like a screen protector. We have tape, and the whole journey of what we're talking about is harvesting these kinds of materials and bring it into everyday products, especially in this time of the pandemic. Company has a market cap of about 8 million. Next slide, please. So there are 4 basic board directors in the company. I'm CEO and executive chairman. 2 other colleagues that reside in Australia. Michael is a very versatile CFO, together with Steve, and 1 board director in the US. Most of the team operationally runs in Singapore, so a lot of the science, the execution, and Tom resides in Australia and is in charge of our sales and marketing. Next slide, please. So the whole basis of where we are today stems from a single virus that all it took is 1 person that, in China that to be where we are today. It's a SARS-CoV-2 strain. It has there are currently 10 mutations, and it's fairly viral and essentially can live on surfaces for as high as 28 days. So we're dealing with all these conditions and all of things that exist today. And so when we started on this journey in 2019, the end of 2019, it was fortuitous that we did it unbeknowing that there would be a virus or pandemic shortly thereafter. So a lot of the science and a lot of the getting ready of a product was just fortuitous. That obviously culminated several months later and allowed us to execute fairly quickly, bringing a product into market as early as July of last year. And I wouldn't trivialize, what it took to take nanomaterials and to put it into something like this, which is in essence just a simple piece of plastic, but has the ability to eliminate the coronavirus in under 15 minutes, which is a feat unto itself. Next slide, please. So today we'll talk a little bit about Nanoshield, a patented product which has the ability to eliminate a lot of bacteria, most bacteria and viruses. Some instances in under a minute, some in under 30 minutes, and the whole journey behind that and how we have brought that to market, including solidifying some good customers on the way. Next slide, please. So please start the video. So the entire science of this is built on a lot of testing. I mean, I heard a little bit about what Brent mentioned just now, and we can't trivialize how difficult is it to do the kinds of testing that can withstand the different standards and the different kinds of tests that exist around the world. So we've had our product tested all over the world. We started on this journey a lot earlier than everyone, and therefore was able to react with standards and information a lot earlier than everyone. And we tested it through a number of different products. So if you take a look at the slide, it's simple. Um, Bacteria, things like influenza, we can bring down the viral count from 1 million parts to under 1,000 in less than 1 minute, in less than 5 minutes in other instances. So it's validating all of that, and it's we're up against a lot of information, a lot of people putting up claims that cannot be backed up, and because there isn't much standards, and it's very, very difficult to test bacteria and viruses. It's important to provide this information in bite size that consumers can understand. A lot of our tests are over 30 pages long. So how do you mitigate communicating that information so that it's, number one, credible, number two, understandable, and number three, it's something that consumers will accept. And next slide, please. So we've pivoted and tried to marshal our products into real life, everyday instances and application. So we communicate that we are able to, through a simple tape like this, be put onto trolleys and handles, so that when you touch the trolley and handle, you would be able to be assured whatever viruses are there would most likely be already be eliminated. Short of that, obviously, you have someone wiping that down every time a trolley is actually used, but that gets expensive, and that gets not sustainable over a period of time. We also are very, very applicable for anything that has a high touch point. So whether it's a phone that you sign when someone delivers your package, a touch screen in a supermarket, a touch screen in an ATM machine, a touch screen when you look at wayfinding solutions in a supermarket, or rather in a shopping mall. All that is something that we can live with. Because it's optically clear, we do not believe we have a lot of, in fact, any other competitor that can provide that kind of quality. And it was not easy to be able to distill the materials into a piece of plastic that had optical clarity. And that's one of our distinct advantages going forward. Next slide, please. So, in summary, we have that very, very visible antiviral protection. A lot of our competitors use a spray. Unfortunately, a spray is something which is dependent on someone else applying that spray. It's something that we can't see, so we don't know if the person that's applying the spray has actually done his or her job applying it, how often they've actually applied it, and how long it actually lasts, even after it were applied, versus what we have, which is something which is very visible. So when you put it onto an object, you'll be able to see it and be assured that that piece of plastic is still there protecting you. Manufacturing is not trivial. We spent a lot of time, even ahead of the pandemic, making sure that that is done well and done accurately, to the point of where we can actually repeat that process over and over again. So it starts with a special compound that we formulated, put into a special matrix that has a way to breathe, and then allowing that to be put into a very big roll, layered into consistent uh, formulation that again gets nurtured and gets UV cured so that it actually allows us to be able to put that through. Now let's next slide, please. So application wise, you know, you can think of ATM machines. You can think of just about anything that you use on a high touch point. Next slide. Uh, these are some of the installations that we've done. I really want to go to the next slide and talk a little bit about this. So we worked very hard on this particular installation and this particular customer, which was actually released. The press release was made yesterday. That culminated after a year of basically having them test our product over and over and over again. And if you think about the amount of monies that takes to actually do the kind of testing, it's between 6 to 7 figures. So for them, for a company as big as Nestle to condone and to say that this is a product that they have tested and I would be marshaling all across the world, is we feel extremely fortunate and blessed that this is done in a scale that we can expect going forward. Next slide. So we expand our distribution worldwide. We already have them in place in Singapore, Thailand, Malaysia, Australia, Philippines, and in the UK. And we typically believe that, you know, we'll sign more of that going forward over the next weeks to months. Next slide, please. So I think we've come to the end of the slides. I'd like to take some questions, make sure I'm still on time.
Thanks, Alfred. Yes, you've still got some time for some questions. Thank you. There's some questions about the life of the Nanoshield film. How long does it last? Does it have to be put on again?
So it's plastic, right? So it's plastic. It doesn't evaporate. It doesn't lose out. It just has a resin that's impregnated onto the piece of plastic. So as long as you don't scratch it out, and we have tests to show whether that it will last between 6 months to 12 months, even longer if you don't really scratch it out. So it lasts a long time.
And congratulations on your announcement with Nestle. Is part of your sales strategy to go direct to these sort of appliance manufacturers, for example?
The distribution process is in place. That we like the last mile to be done by our partners and our distributors. We think there are many Nestle's around. We chanced upon them, you know, almost a year ago, but we would prefer to work through our distributors for the last mile. And there are many companies out there that are looking for a solution as this.
And what is the best use for the product in terms of the market, in terms of where you start?
It's very versatile, right? I mean, we sell a piece of plastic like this. So this plastic comes in a roll that you can put it into, you know, into your doorknobs, your door handles, into your fridge doors, into a face shield like this, so that, you know, instead of having just a piece of plastic, you would have something which has antiviral capabilities. So the applications are quite limitless.
And given COVID raised everyone's awareness around disease and spreading disease. Are there any applications for the consumer, or will it be direct to the manufacturers?
I think even in the presence of a vaccine, which has it still will take years before everyone is vaccinated, and even at that, the efficacy is not 100%, and even at that, it still is something which may mutate. So I think this is almost akin to a permanent, semi-permanent soap. So you put it there, and you believe that it will be there to protect you. So answering your question, you know, it can be a mix between consumers to businesses. Instead of buying something that you put into your door, you just buy this piece of tape and you just wrap it around, even on your phone, right? I mean, there are studies to show there are more germs in your phone than there are in the toilet seat. And we put our phones all over. I mean, I've been sitting down, I put it onto a table. So how much germs is it picking up? And we do that every day. So, and as you know, the germs and the viruses last for up to 28 days. So think about the time that it will take to mutate from your phone to your ears.